Good day to you all, and thank you to the Global Action on Men's Health team and Peter Baker for the kind invitation to join this very crucial side event at the World Health Summit on improving men's health and a pathway to improving global NCD outcomes. I will share a bit on men's mental health in Africa. My name is Chido Rwafa Madzvamutse. I'm the mental health focal person at the WHO Regional Office for Africa. Just starting off by saying, often we recognize that women who are likely to have challenges with depression and anxiety. However, boys and men are seen to have higher rates of alcohol and substance use, interpersonal violence, conduct disorder, autism, and ADHD. However, we are increasingly understanding that depression and anxiety do occur amongst men, but often this is under-recognized, often even misdiagnosed in men. Moving on to suicide, globally, we know that more than twice as many males die by suicide compared to females. And in the African region has the highest suicide rate in the world at 11.5 per 100,000. And the rate of suicide amongst men in Africa is highest at 18.4 per 100,000 compared to 12.4 in globally. And behind these statistics are fathers, are brothers, are colleagues and friends. So it is critical that we do something about these preventable deaths. What are some of the challenges that drive us in terms of men's mental well-being? Yes, we acknowledge the biological issues of genetics and hormonal differences about how men experience stress, but psychosocially, issues around gender-related beliefs, norms, and values put men under incredible pressure to be self-reliant and stoic and invulnerable. And then also poor psychosocial support structures as our communities are changing from more communal living to more nuclear families. This limits the social support that might be available for men. And even where there are people around, there might be a sense of isolation. And financial difficulties, problems with employment or losing employment. Often men sadly are judged by what they can bring to the pay table and what they can earn rather than who they are. Issues around violence and abuse, which is often underreported in men, particularly sexual abuse in boys and young men, which can affect them for the rest of their lives. But this is often under-recognized and as challenges. Life transitions of adolescence, marriage, becoming a father, getting older, all of these are challenges that can affect men's mental well-being. What are some of the barriers in terms of access to care? Men are less likely to seek help than women for all health issues, including men's mental health. And traditional masculinity norms and cultural stereotypes and gender roles often inhibit men from seeking help for psychological problems. Men are often expected to remain stoic and strong and silent, sometimes in the face of extraordinary challenges. And men who adhere closely to traditional masculinity norms of self-reliance, lack of expression of emotions, independence, dominance, and self-control are less likely to disclose when they're having challenges or to seek assistance. And cultural views may also and do also socialize men to hide their emotions, and making it difficult for men to recognize, express, and manage difficult emotions and seek help when they need it, leading to delayed identification of challenges. The lack of awareness about how mental health challenges may present in men, difficulties articulating emotional distress, but also minimizing or misinterpreting psychological symptoms can also delay identification and appropriate treatment. And then, last but not least, stigma is a major barrier to men engaging in psychological therapy or taking medications for mental health, because there's often fear of being judged as weak and exposing one's vulnerability. In terms of services, there's limited policy guidance of men's mental health in the region, and health systems do not really adequately serve men's health, mental health needs. In terms of general health services, women spend 6 times as much seeking health services compared to men. So when it comes to mental health, this might be comparable. In many settings, the health delivery channels are not designed for men, they're designed for women. Often in health guidance and programming and research, the target groups are women or young people, but not specifically men. And this then limits the culturally appropriate services for men. So late last year, on International Men's Day, we did host a conversation, a webinar on men's mental well-being, trying to really address the issues of the very high suicide rate, start the discussion to see what are some of the issues that are influencing this, and start discussing more about how policies can be reformed and how we can do better for men. The event was well attended, and Prof. Derek Griffith from Global Action on Men's Health joined us and shared on how we can create systems to improve men's mental well-being. We also had the International Association of Suicide Prevention, the special interest group on suicide prevention in boys and men also joined us, as well as the Minister of Health of South Africa sharing on a very practical example of how to integrate men's mental health into a men's health clinic. And we had a man share his experience of depression and how he sought help and eventually regained his mental well-being. Some of the feedback from the participants was quite encouraging, that there was a need and for more platforms like we had created to start to engage with men. And they echoed the notions about traditional masculinity norms and challenges around that, and allowing for empathy for men and vulnerability amongst men. Going forward, what are we thinking? Engaging with men, really doing consultations, because we really do need to understand what are some of the factors that are influencing men's mental health in Africa and how this can be addressed, but also to start asking questions around how services can be more responsive, more accessible, more appropriate for men. And really, needs to be informed by men, particularly men with lived experience of mental health challenges. And then, of course, starting to then guide through this consultation to start thinking about how we can guide policy and strategy development to address the needs of men better. So thank you again, and I hope this gives a contribution to this discussion. My sincere apologies that I could not join you in person, but thank you again for this opportunity to intervene. And I will stop there.